Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Wednesday, August 26th, and this is my briefing. We've had 417 cumulative positive cases of COVID-19 in Missoula County to date. That's up 7 cases since yesterday. We've had 367 recoveries and 3 deaths. 3 Missoula County residents and 2 non-county residents are hospitalized in Missoula County currently, and we have 47 active COVID-19 cases with over 270 close contacts. Those active cases and their close contacts remain in isolation and quarantine and are being supported as needed. The state of Montana is reporting 6,785 cumulative COVID cases, which is up 162 new cases from yesterday. There are now 1,704 active cases in the state with 125 active hospitalizations. There have been 98 deaths related to COVID-19 statewide. So I have a few topics to cover today. First, I want to let you know that the way our cases are being reported to DPHHS, the state health department, has been revised. While there's still some minor discrepancy in the numbers between our website and the DPHHS website, they are getting closer to matching, and hopefully we will continue seeing that getting better as we move forward. Next, I know that many of you have had some questions about football as we are approaching the beginning of school and football season is upon us. Our health officer, Ellen Leahy, will be providing guidance for football by the end of the week this week, so I just wanted everybody to know that. So next, I've received a lot of questions about how cases related to the University of Montana will be reported and tracked. We've been working with the university for the last several months on a variety of topics, such as testing on campus, contact tracing in the university setting, general prevention strategies, and how and where to quarantine and isolate U of M students who live on campus. The University of Montana does have plans to facilitate testing on campus, and when a positive COVID case is identified, they will report that to us here at the health department. Those students who live on campus will then be put into isolation and will be proceeding with contact tracing the same way that we do with all of our other cases. Those students and staff identified as close contacts to a case are then contacted by our staff here at the health department, and quarantine is coordinated between us and the university. Cases associated with the University of Montana will not be reported specifically separate and apart from our other numbers, as we do not generally report a case associated with any particular location. The university may at some point choose to self-report if they were to see a cluster, but in order to protect the privacy of those involved, we do not report that information. The exception to that would be if we had a case in a location where we needed to report it in order to identify the contacts. An example of that was when there was a staff person in a restaurant that tested positive, and we needed to identify the times and dates that that person worked so that we could identify patrons who may have been exposed. Then that would be a similar situation on the university campus if we were to need to report that in order to identify other close contacts. That said, internally, we are tracking the cases that are associated with the university so that we have a clearer overall picture of what's happening with COVID in our community. And if the cases associated with the university were to begin to skew our data, we would certainly address that publicly. So lastly, I want to let everyone know that while we had some time where we were having delays in getting test results back, our results are now coming in within 24 to 72 hours, and most are actually coming in within 24 hours. So if you're having symptoms of COVID-19, please get tested. You can schedule a test through our facility at Flynn Lane by calling 258-INFO, and the tests there are free, or you can contact one of the other healthcare providers that are listed on our website that are providing that kind of testing. But we would encourage you to get testing if you're having even the most mild symptoms of COVID-19. So that's it for my briefing today. Please continue to practice those preventative measures, wash your hands, practice social distancing, and mask up, Missoula. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. You can check out our website at missoula.co/cvirus, and you can call 258-INFO if you would like to schedule a test for COVID-19, or if you just have general questions about COVID-19 or want to know what resources might be available to you. So until tomorrow, everyone stay healthy.